Hello everyone. Today we'll discuss about urinary tract infection or UTI. So, what is UTI? UTI is a microbial infection. UTI is a microbial infection which is caused by any microbe. Basically, the microbe is bacteria. Okay, most commonly is E. coli, and it will affect any part of the urinary tract. Okay, so if it the organism will affect the lower urinary tract, then we'll call it cystitis. Cystitis is the basically inflammation of urinary bladder, and if it will affect the upper part of urinary tract, then we'll call it pyelonephritis. Pyelonephritis basically, if upper urinary tract is infected or mainly kidneys are affected, then we'll call it pyelonephritis. So in this diagram you can see, like here we can see kidney, ureter, urinary bladder and urethra. So if upper part like kidney and urethra is affected, then we'll call it pyelonephritis, and if bladder and urethra is affected, then we'll call it cystitis. Okay, so here you can see, like in pyelonephritis the kidneys are affected. If ureter is affected, then we'll call it urethritis. If urinary bladder is affected, then we'll call it cystitis, and if urethra is affected, then we'll call it urethritis. And as in males, like prostate is present, so if prostate is affected, then we call it prostatitis. Okay, so here the condition appears like UTI is more common in female as compared to males. Why? Because females urethra is short as compared to male urethra, and the female urethra is close to potentially bacterial contaminated organs like anus and vagina. Here in this diagram you can see, like this is a urethral opening and it's very close to vaginal opening. So if any organism, like we know, like vagina is full of many organisms which harbor in the vagina. So if any organism will reach to urethra, and so it will cause UTI. And if proper hygiene is not maintained, then organism from anus will reach to urethra and will cause UTI. So what are the risk factors for UTI? So first is sexual intercourse, second is pregnancy, third one is viparium, fourth one is pelvic organ prolapse, fifth one is estrogen deficiency. And estrogen deficiency will most commonly, like it's seen in postmenopausal women. Then post-operative period, because in post-operative period we see, like mostly patient are having catheter and all. So due to that catheter insertion, if proper hygiene is not maintained, so bacteria and all will reach to urinary bladder or urinary tract and will cause UTI. So what is the classification of UTI? It's basically classified in two parts, like acute and recurrent. Acute UTI and recurrent UTI. So first we'll discuss about acute UTI. Acute UTI is further divided into two parts, like uncomplicated acute UTI and complicated acute UTI. So in uncomplicated acute UTI, majorly two things are seen: cystitis, like if urinary bladder is affected; pyelonephritis, if kidneys are affected. So in acute uncomplicated UTI like cystitis and pyelonephritis, they confine to bladder. Okay, and the organism which cause UTI is antibiotic sensitive. So if we will give antibiotics, so the UTI will get rid of. Okay, and we, like patient is okay. Then after the second part, the complicated UTI, first thing cystitis and pyelonephritis both, then it spread beyond the bladder. Mainly it will reach to ureter or kidney, and the infection that is like the causative organism is multi-drug resistant organism. Okay, so now we'll discuss about what all conditions that complicate UTI. So first thing is diabetes, because in diabetes, like sugar level is high, so it's a better place for all the organism to multiply there. Then in pregnancy, because our immunity is low, then urinary tract obstructions, like any stone and any tumor or any mass is there, so urine will get collected there, and due to that collection, microbes can easily multiply there. Then any anatomical abnormality, Then fourth, hospital acquired infection, because hospital if proper hygiene is not maintained, so people will, due to that catheter and all, they will uh, come in contact with UTI. Then fifth thing, renal failure, because in renal failure urine is not properly filtered, so many infective molds or any egg like that, they will affect our urinary tract. Then after renal transplant, then indwelling catheter you can see if catheter is not properly inserted, or if proper hygiene is not maintained, if when we are inserting the catheter, then after in that condition UTI is more common. Then what all organism that cause UTI? First and important, it's E. coli. So E. coli is the commonest. Okay, E. coli is the commonest. It's more common. Okay. Then after Klebsiella, Pseudomonas, Proteus, Streptococcus, then Enterococci. This is a diagram of E. coli bacteria. Okay, you can see the flagella, DNA, then its size is 3 micron, ribosome, genetic material, cytosol, pili. The pili and flagella. Flagella will help in the motility of the bacteria, and pili will help in attachment. Okay, what all are the signs and symptoms of UTI? So first we'll discuss about cystitis. What is cystitis? Cystitis is the inflammation of urinary bladder. So if a person is having cystitis, then what all signs and symptoms we'll see? Like frequency of the urination is more, urgency is more, dysuria means pain during micturition, then hematuria, like urine is having blood cells, then pelvic pain is there, fever is there, backache is there. If acute condition is there, acute cystitis is there, then patient is having dysuria, frequency is more, urgency, suprapubic pain, and hematuria. Hematuria means blood in the urine. Then what about pyelonephritis? Pyelonephritis is the inflammation of the kidney. Then in pyelonephritis, like if kidneys are affected, then patient is having high fever with chills, vomiting is there, loin pain is there, renal angle tenderness is there because kidneys are affected, sepsis will be there, chances of sepsis will more in pyelonephritis. Then shock, if because we know kidneys are the house for erythropoietin secretion. So if erythropoietin is, because kidneys are affected, so erythropoietin secretion will be less. So due to that less erythropoietin secretion, RBC like blood is less. Okay, so due to that patient will go into shock. Then multi-organ dysfunction, because filtration of many nitrogenous waste, blood, and other particles will occur through kidney. So if kidneys are affected, then it will cause multi-organ dysfunction. So what all investigations will do for confirmation of UTI? First and important is urinary examination. Then second, dipstick test. Third one is urine culture for finding the organism. Then USG, in USG we'll see like which part is affected, lower urinary tract is affected or upper urinary tract is affected. Then CT. CT mostly will be seen if pyelonephritis, like if it's a complicated UTI, and if recurrent UTI is there, so we'll see about in CT. So urine analysis, urine culture, blood test, imaging test like CT, then cystoscopy, urodynamic studies, then intravenous pyelogram. So now we'll talk about how we can manage UTI. So if patient is having acute cystitis, and acute cystitis we'll see in two conditions like complicated and uncomplicated. So if uncomplicated acute cystitis is there, so we'll give oral nitrofurantoin. Okay, so what we are giving? Oral nitrofurantoin. What is the dose? 100 mg is given 2 times a day for 5 to 7 days. Okay, this is given in uncomplicated acute cystitis. So now we'll discuss about complicated acute cystitis. So if complicated acute cystitis is there, then we'll give ciprofloxacin. Okay, in uncomplicated we are giving nitrofurantoin, in complicated we are giving oral ciprofloxacin. What's the dose? 500 mg. We are giving 2 times a day for 5 to 7 days. Okay, then we'll discuss about acute pyelonephritis. Like acute pyelonephritis is further divided into two: uncomplicated and complicated. So if uncomplicated patient, like if uncomplicated patient is coming, like there is no such signs and symptoms, then we will treat as OPD case, like outpatient department. So what we are giving ciprofloxacin orally 500 mg 2 times a day for 7 days. Okay, what about the complicated case? So if complicated acute pyelonephritis patient is coming to us, then what we are giving, we will treat that patient is at inpatient department. Okay, and we are giving injection ceftriaxone. Okay, ceftriaxone is given, what's the dose? 1 gram is given intravenously 6 hourly. Okay, till the organism load in the blood or urine is maintained. So what about the recurrent cystitis? So if patient is having recurrent cystitis, we are giving oral norfloxacin. Okay, what we are giving? Oral norfloxacin. What's the dose? 400 mg is given orally once a day for 6 months. Okay, so how can we prevent UTI? What's the prevention of UTI? So first and important, we have to increase oral fluid intake. Second, for after any sexual intercourse, women should void or male should also void, because organism from urethra or from male urethra will goes to urinary bladder or ureter, like that. Then we have to like avoid holding urine for prolonged period, because if we are holding urine for more time, like so bacteria will grow there and it will cause UTI. Then for postmenopausal women, we have to use estrogen cream. So like general urinary tract infection prevention tip, what all prevention we should take, like before and after sex we have to clean our genitals. Then void after any sexual intercourse, then we have to wash our rectum daily so that any organism from anus will not go to urethra. Then we have to drink lot of water so that any filtration of blood is more, so organism and all are there, so they will not grow, because if we are not drinking proper amount of water, so our urethra will when we are drinking less amount of water, so our urine color become dark. Okay, and that in dark color, like due to the concentration of that urine, so organism will further multiply more, and it will cause UTI. Then don't hold our urine. If we are holding our urine, then bacteria will multiply in that, and it's a better environment for them. So don't hold your urine. So it's all the preventive tips for urinary tract infection. So thank you.